Thank you for your patience. It's a little bit after 1. We're going to get started. Welcome to the press conference for the Johnson County Emergency Operations Center for Tuesday, March 31st. Thank you to those in the media reporting on this and to our community partners who are participating and for those watching online. Just a few reminders, we are working with American Sign Language interpreters for this press conference, so reporters, make sure you are including them in your shot. We are streaming this live on Facebook on the Johnson County Public Health page, and we do have a microphone from City Channel 4. So for the reporters, when you have a question, please step up to the mic, state your name, affiliation, and ask your question so that it can be picked up on the audio stream. We are practicing social distancing, so we have limited the number of people in the room. And for those purposes, I will bring in each speaker one at a time. They will make their statement, and then we will open it up for questions for that individual. So if you do have any follow-ups after that, after a person has spoke, just touch base with me and I can get you connected for follow-up. As you all know, this is a rapidly changing situation, so we appreciate your patience and flexibility. We are changing it up a little bit today. We have Dr. Tracy Brennan from UIHC remotely with us, and we will get started with her. So, Dr. Brennan, you are up.
Okay, Dr. Brennan, we're ready for you.
Go ahead now.
Yes.
I'm sorry, you want me to start now?
Yes, you can start.
I can't hear you all. Great, thank you. Good afternoon. This is Tracy Brennan. I'm the Chief Medical Officer at University of Iowa Hospitals and Clinics. Happy to be here today to speak about what is going on with COVID-19 here at UIHC. Presently, we have 5 inpatients in our hospital. We have had 7 other patients who have been hospitalized since our first patient on March 11th and who have been successfully discharged home. We also continue to monitor through our home treatment team between 20 and 30 patients per day who are COVID positive and who have been in that high-risk group. We're contacting them and speaking to them on a daily basis. So far, we're managing through this surge and doing well with it. We continue to follow the guidelines from the CDC with regard to our personal protective equipment usage. We are actively managing and conserving wherever we can, but not putting our faculty or staff at risk. We certainly want to thank the community for all the efforts that have been offered and made to help us with PPE and other things. We are very blessed to live in this community and have wonderful Iowans that are here to support our healthcare workers. We ask that the public help and do their part as well. So first and foremost, we'd ask you to stay home. Efforts to social distance, making sure that you're staying outside of 6 feet from anyone, particularly those who are ill. Continuing, as we've said from the start, to wash your hands frequently using soap and water for 20 seconds lathering or hand hygiene gel. We also want to make sure that you're continuing to do the common things like not touching your face. It's important to us that if you are not COVID positive, that you continue to maintain both your physical and mental health. We are hearing from the patients who have acquired the disease that hydration is really important. And so I'd ask you in your day-to-day to continue to stay hydrated and get good sleep. From a mental health standpoint, it's also really important to recognize that staying at home is very hard for many of us. And so continue to keep in contact with friends and family. Distract yourself. If you are able to walk outside, again, maintaining social distancing, do that. And if you need help, please know that we and others are here to help you. Finally, I want to make sure that people know that if you need health care and it's not COVID-19 related, that we are continuing to provide that care. We know many patients that we care for have chronic and complex medical illnesses, and they continue to require frequent care. We have changed a bit how we are caring for patients. We are doing more clinic visits by telephone and by video, and have been able to successfully do that. But even if you need to come to the hospital, know that we are prepared to care for you in a safe way. Thanks so much.
And we can open it up for questions now. Step up to the mic.
Hi, Travis Breeze with KWWL. I remember the university said when classes went fully online that students on who have patients that they see as part of their classes, that those would continue to happen. Can you give an update on that and have those switched to telehealth appointments as well?
Kelly, I'm not able to hear the question. If it's directed toward anyone not in the room with you, could you please repeat it?
Step up here and ask the question.
Sure. Hey, Dr. Brennan, can you hear me now?
Yes, thank you.
Yeah, no problem. So this is Travis with KWWL. When we went to, I think, the first press conference when the university said that it was going to be moving classes online for the rest of the semester, we were told that students on clinical rotations who were seeing patients as part of their studies, that those would continue. And I was wondering if you know if that's still the case, and if so, if those classes are now doing telehealth appointments as well.
We continue to have medical students who are in clinical rotations participate in care of their patients, as well as nursing students and others. I'm not sure I can answer the second part of the question. The telehealth, can you repeat that for me?
Wondering, as you say that, I believe I heard you say that UIHC is, like other area hospitals, trying to transition to more, appointments over the phone or over video. I was wondering if students were doing that too.
I'm not aware of any students that are actually participating in that. There may be departments that have residents potentially participating in the telephone or video visits. Obviously, the staff are there and supervise and interact with the patients as well.
Can you talk a little bit about staffing at UIHC hospitals right now, and has there been a strain put on that by some of the student body leaving, or and then kind of in general too, kind of like a big picture look at if you guys are still where you need to be as far as staffing goes?
Good question. So with regard to the students, we certainly rely on students to assist in certain areas as employed staff, part-time employed staff. If those students are not able to continue, we recognize that if they don't have a place to live, that's going to be a hardship for them. And so we're backfilling those as we need to with other staff. With regard to our entire staff, right now we're doing okay. We are monitoring the needs as we see patients, both COVID positive and COVID negative patients. We've also developed a labor pool, so we have a pool that we can pull from. We've been pretty aggressive about trying to get staff to be able to work from home, because if they don't need to go out of their house, we would prefer that they stay home. Some of those people could be called back, and we have many staff that are at the ready. So if we need them, we can pull them into active clinical work as we need.
So you would say right now that you wouldn't say there's any problem as far as staffing goes? Like there's not a lapse, really? No,
right now we're okay with staffing.
Can you talk a little bit about maybe some facilities at UIHC hospitals that have been converted specifically to test or treat patients with COVID-19?
Sure. So we have a great team here, and in the beginning, we created a model through our UIP, University of Iowa Physicians, and Dr. Van Dale to convert many of the visits that were going to quick care and urgent care and even our primary care facilities for COVID-19 type symptoms, for influenza-like illness symptoms. They first are seen by a video visit. If the video visit identifies that they either need to be tested or they need to be seen because they're not doing well, then they are directed to our influenza-like illness clinic, where patients come in and get either testing, evaluation, and treatment, or both. If the patient needs an emergency room, they would be directed to the emergency room as well. So those are two new areas that we were not previously doing prior to COVID-19 coming on board. We have converted some of our inpatient units to negative pressure units to be prepared for the potential for a surge of COVID-19 patients. And we have a surge plan that we are in the process of finalizing presently.
Okay, thank you.
You bet.
Do we have additional questions for Dr. Brennan? Yeah, come up here. Where's Dana?
Hi, this is Emily Chavez with KGAN. I was just wondering, I know that the top 3 personal protective equipment needs, I spoke with the CEO yesterday, are face shields, N95 masks, and gowns. Can you talk a little bit about the CDC guidelines to which you are trying to conserve these masks? What are your healthcare workers having to do to follow these guidelines and make sure that you are managing these masks?
Right. So thanks, Emily. You're absolutely correct that those are the 3 areas that we're watching closely. We have an interactive dashboard where we can look at the number of patients we have, the utilization of all of those personal protective equipment pieces. What we are doing is following CDC guidelines, which is droplet precaution. And we are asking our staff who are coming into contact with either those that are being tested for COVID-19, also called a person under investigation, or PUI, and those patients that are positive for COVID-19. They would wear a face shield, a standard surgical or isolation mask, a gown, and gloves. And so those are really the most important things at this point in time for the standard patient who is either a PUI or who is COVID positive. N95 masks are really aimed at aerosol transmission, the protection for people who are concerned about or at risk of aerosol transmission. And so we are reserving those for the people who are in what we have identified as aerosol generating procedures. Things like an intubation of a patient, putting a ventilator, a breathing tube into their throat in order to put them on a ventilator. Patients who are getting nebulizer treatments. Any patient where the droplets could be aerosolized into the air and then have a greater risk of exposing people. So N95 masks are a bit more challenging to come by. Everyone is having challenges with those. We have also developed mechanisms to reprocess those. We are not doing that for COVID positive patient interactions right now, but for someone who is in an emergency situation, for example, a patient has a cardiac arrest and a team needs to go in to resuscitate, those people would wear an N95 mask because we want them to be protected in the event that that patient could be COVID positive and we didn't have enough time to evaluate the patient well enough to know if they could be or not. In those situations and in situations in the operating room where we're taking special precautions, those are being reprocessed. We're using hydrogen peroxide at this point in time. Does that answer your question? Great, thank you.
Hi, thanks for videoing in with us. I'm Sarah Watson with the Daily Iowan, and Vice President Brooks Jackson mentioned last week, just very briefly, a convalescent plasma treatment but didn't really elaborate. I was wondering if you could speak to some experimental treatments or what you're doing for COVID patients at UIHC.
So right now we're in the preparation phase for convalescent plasma use. So what that means is someone who has had the disease and has recovered, those people would have antibodies to COVID-19. And so the goal with convalescent plasma is to take their antibodies and give it to someone who needs them to fight the disease. We're very fortunate to have a VPMA who is a transfusion medicine physician. So he has done this with other diseases and knows what needs to be done and how to collect the plasma as well as how to deliver it to the affected patient. Right now, we're in the process of getting approval through the FDA, of course, and also through our Institutional Review Board, or IRB. At this point, we don't have any patients who are far enough out in their convalescence or their recovery in order to collect their plasma, but we will be looking for volunteers to collect their plasma so that we can then help other patients.
Gotcha. How long do you think that process would take to where a patient would be able to give their plasma? It's pretty complex, and I'm not sure that I have everything, but we can certainly supply protocols once they're available. And then also last week, and you mentioned a little bit that you guys were still formalizing your surge plan, and I was wondering if you had an updated timeline of when you thought that would be released or finalized.
Yeah, it's pretty complicated because we had to identify, we have an emergency surge plan, but this is a little bit of a unique situation. And so we had to adapt that and identify areas that we would surge to, and then looking at what sort of people resources as well as equipment and medication resources we would need with the surge plan. Those are presently being reviewed, and we'll be socializing those within our own leadership group to a greater degree over the next several days. And we hope to have that available hopefully in several days. Not entirely certain. As you socialize it, we get good suggestions from many leaders, and so it's good to do that, and it's also somewhat time consuming.
And so Johnson County in particular has been the county with the most cases for a while now, until Lynn County recently surpassed Johnson in terms of just number of positive cases. And I'm wondering kind of why that is now that there's that kind of that trade-off, or I know that there was that outbreak in the long-term care facility, but if if you could speak to why Johnson County has kind of stabilized or even plateaued in terms of number of positive cases.
Yeah, I mean, I would say that I hope that it's because of the great work done by our Iowa Department of Public Health and Johnson County Public Health departments in making certain that people who are COVID positive know that they need to be quarantined, and that those people are maintaining that. I think that a lot of work has been done by our institution and Mercy and others in the corridor to try to follow those patients and continue to have those patients under surveillance and making sure that we know when they're getting potential to spread. I think the other thing that is really important that has been done by all three facilities, the Iowa City Mercy facility, the VA hospital, and ours, is to institute restrictive visitors in the hospital. I think that is really hard because patients require their family members to be near them for emotional support. And so it was a really hard decision, but I think it was really important in helping us to really contain the virus. I'm hopeful that this continues, that we don't have more surges within Johnson County, but it is certainly possible if people don't take care and self-isolate and continue to do all those good and healthy things that we talked about, washing their hands, not touching their face, etc., and social distancing. It is hard for Lynn County in particular, and for others when an outbreak happens in an area where people are very commonly socializing like in a nursing home facility. And that does increase the spread significantly. I know they're all doing their best to try to keep their patients in their own rooms and to limit socialization because of the fact that the spread can occur. But I think that's a part of a reason why Lynn County now has more cases than Johnson County.
Thank you very much.
Question from Zachary Oren-Smith with the Iowa City Press-Citizen.
Sure.
Are you concerned that patients aren't seeking necessary non-COVID-19 related care?
I guess the simple answer is yes. I think that is a concern. Patients make choices, and this is a terribly fearful and anxiety-provoking time. And I do worry that patients may elect to not seek care because of concern of, coming into contact with someone who is COVID positive. I would say to those patients that I believe the likelihood of you coming in contact with the virus here in our hospital is no different than it is in the community. And so I would just take precautions, wash your hands when you come in for your visit, go straight to your clinic, then go straight home. Don't be stopping at unnecessary places. But if you have a chronic medical condition, this is a marathon. This is not a sprint. So it will likely be days to weeks before we peak and before things seem like they're under control. And so if you have a chronic medical condition, you likely are not going to be able to wait for that. So I would encourage people, if they have a chronic medical condition that needs intermittent health care, or if they have something that comes up that is more urgent or concerning, for sure call your healthcare provider. As I said, we're not alone in doing things differently, but we are doing telephonic visits, video visits, and of course we're seeing patients that need to be seen. So I'm sure that it is making people anxious to go to a hospital or even come outside their house. But if you need medical care, you should seek it. Call first, if possible.
Any additional questions for Dr. Brennan? Okay, great. Thank you, Dr. Brennan. We have no further questions. We appreciate you joining us remotely.
Great. Thanks so much. I appreciate the media getting all this information out there to help patients deal with this. Thanks so much.
Stay
safe.
All right. Now we have Dave Koch, Director of Johnson County Public Health.
Thank you, Kelly. Welcome this afternoon to everybody that's tuning in, listening, or watching. Before I start on the prepared statement, I really want to take this opportunity to thank two different groups. First, the healthcare workers that day in and day out are tirelessly providing care to patients, not only COVID-19 patients, but all of the other individuals in their healthcare facilities. We can't thank you enough as a community for the dedication, the commitment, the sacrifices that you are making. The time away from your families is just astounding, and we're very thankful to you. Second, we've all been hearing over and over again, whether it's from me or my colleagues at the state level, nationally, everything that we're hearing about staying home if you're not feeling well, washing your hands, all of those precaution messages. So all of you that are watching or listening and that have been heeding those guidance and those tips, I want to personally thank you as well. To those individuals that feel like that's not important or you're not maintaining 6 feet from other individuals, I sincerely ask that you continue to understand the risk that you are putting yourself and others at when you're not maintaining that distance. This is an extremely serious situation that we're in, and I just can't stress enough the importance of that. So with that, again, I just want to thank those of you in the community that are practicing the physical distancing from others, that are staying home if you're not feeling well, those businesses that have initiated telework. It is making a difference, and we thank you. Johnson County Public Health continues to work with the Iowa Department of Public Health and our local partners to contain the spread of COVID-19 in our community. Currently, in Johnson County, there are 73 positive cases and 497 in Iowa. 31 of those 73 cases have recovered from COVID-19 and are no longer considered infectious and are now under the same recommendations as the general public. This is a confusing time, and being surrounded by family and friends is what many of us would normally do to de-stress and to find comfort. Johnson County residents, this is not a normal time. We have been asking you to stay home and socially, physically distancing yourself 6 feet away from others. But I would like to be very clear what this means for our current everyday lives. While you are safer at home, that it is only if you are not having those who don't live with you, your neighbors, friends, and extended family, over to your home at all. This means that you should not have a friend over to do their nails because the salons are not open. You should not allow your kids to play basketball in your driveway or at the park with other children. And trust me, I understand how challenging this is. I have 2 grown children, and I sympathize, I recognize, but the importance of this cannot be stressed enough. It is perfectly normal for everyone to feel stressed at this time. We know this social and physical distancing can feel isolating and stressful, and it requires great discipline to keep telling your children, no, your friends cannot come inside the house or into the yard to play. If you are allowing this, you are not protected, and you are not protecting your family, friends, and neighbors. You and your children could pass this on to someone who is at greater risk than you are of getting seriously ill, someone who is elderly or has underlying health conditions. Please explain this to others. We are all in this together. Thank you to all of Johnson County residents who are making big and small sacrifices in your daily lives to stop the spread of the virus. And on that note, I just want to reiterate the fact that we do appreciate how this is disrupting all of our lives. It's not just 1 or 2 of us. It is every single individual in this community. And we just want to, again, stress the importance of adhering to the guidelines that your local public health, elected officials, partners across the state are providing. So with that, I'll open it up for questions.
Emily Chavez with KGAN. I know that the Johnson County Board of Supervisors asked Governor Kim Reynolds to provide a shelter in place. I was wondering if Johnson County Public Health, what's your stance on that?
So personally, well, not personally, but from a public health standpoint, we look at the data, and we're in constant communication with Iowa Department of Public Health, which also provides guidance to the governor's office and her staff. And so we continue to be aligned with Iowa Department of Public Health and their guidelines.
Other question. So now with warmer weather kind of coming our way, I've also personally seen a lot of people outside maintaining their 6 feet, but maybe going on jogs or going to the park. Are you now saying not even people shouldn't even do that?
That's a great question. And no, we are not saying that. So I personally was outside several times this past weekend. And people are really adhering to that 6 feet, as you're mentioning. And we appreciate that. And we encourage people to continue to go outside, continue to provide that 6 foot distance between others. So as I was passing people on the trails, we were both moving off the trail to maintain that 6 feet. I think it's critically important in this time when it's so stressful for everybody that people are getting outside to get fresh air, to get sunshine. It helps our physical and mental well-being. It also improves our immune systems to be able to fight off the virus. There's just so many positive reasons to be able to go outside and to enjoy the nature and our parks. So we absolutely would encourage people to get outside when the weather is getting nicer, but still to maintain that distance. And I just think it's an opportunity for us. This is a message that I don't think anybody has not heard. So if there are individuals on the playground playing basketball with their friends. I don't think it's out of line for anybody to go up to them and say, you know what, in this time that we're at right now, I know it's not easy to do, but really it's important to maintain that 6-foot distance. And so I just think all of us having the ability and the right to really share that message with others should not in any way be offensive to anyone, because everybody is hearing this message. And I just think it's critically important that we all have a part in helping slow this spread. And really it's for the elderly, it's for those individuals that have underlying health conditions, and it's for our healthcare system and healthcare workers to keep everybody safe.
Great, thank you.
Thank you.
I've got a remote question for you from Kate Payne with the Iowa Public Radio. She asked, the state confirmed yesterday that there was an outbreak at a nursing home in Lynn County. What are we doing here for nursing homes in Johnson County to prevent outbreaks and catch them quickly if and when they happen?
That's an excellent question. And to the credit of several individuals, both at different levels, public health, emergency management, members of the Board of Supervisors, collectively reached out to long-term care facilities in Johnson County, and they've had an ongoing relationship with those facilities in preparing for a number of different things. So those relationships were already built, and early on there was daily calls set up every day, including Saturday and Sunday, with all of the long-term care staffing in the long-term care facilities in Johnson County. And so we were having those open discussions, identifying if they had enough PPE, encouraging them on their sanitation, encouraging them on monitoring their staff and their clients as well. So there was a lot of things in place here locally to really prevent any outbreaks or any ability for the infection to get inside those facilities.
Sarah Watson with the Daily Iowan. I'm wondering, as testing is getting ramped up, I'm wondering if there's still any concern of under-testing and then underestimating the scope of the virus in Johnson County?
That's a good question, and I think that's excuse me, that's a question that is an important one to ask. I think as additional sampling and testing is going on, we're going to have more and more data that we're able to utilize to make well-informed decisions. Without that data, also, we're not able to really learn as much as we can about this virus. And so it's critically important to be able to continue that testing as often and as available as those test kits are.
Travis with KWWL. Did you say last week that you guys were working on either refining or expanding your plan that you would share with us as far as the contact that you have with patients? Does my memory serve correctly?
So yes, Travis, I believe what you're referring to is the process of the investigation, surveillance, and follow-up. So 2 of our disease prevention specialists, Jennifer Miller and Jake Riley, have created a short video. It's a great video that explains everything that they do from start to finish. And I don't have that with me, that link, but we'll provide that to everybody so that you can see the video that they've produced.
And would you say that this process, has it changed as staff may have been spread more thin or as the virus may have spread more quickly throughout the county?
Our process right now has not changed at all. The only slight change was early on when Iowa Department of Public Health was issuing isolation and quarantine orders. That recommendation stopped. Our steps in the process of investigation has not changed. It will not change until Iowa Department of Public Health tells us that those guidelines will change. But until then, we're doing additional training of staff in-house to be able to accommodate all the additional cases coming into our county.
Do you have any update on, I know Sam Jarvis was here last week and asked for signups, I think, for the Medical Reserve Corps locally. Do you have any update on that?
I do not have an update on how many individuals we've had sign up, but we can get that information to you. I know that we're working on getting additional people signed up, and it's something not just for this particular event, but the MRC, the Medical Reserve Corps, would provide capacity for a number of different situations that we might find ourselves in.
Thank you.
Okay. Great. Thank you, everyone. Oh, I'm sorry.
Quick
I'm sorry.
question. Hi, I'm Marlon from KCRG. Are you seeing a lot of people that are not doing the social distancing as they should with the 6 feet?
Personally, I have not, but I've been in my office a lot, so I haven't gotten out as much. But certainly, as I said, when I was out yesterday, this weekend, people are. But we're getting emails and calls from individuals letting us know that there are people congregating still. And so really, the messaging for us will be to continue to work with individual groups or individual communities in a number of different ways. Our public information officer, Kelly Andreessen, and her team will continue to develop strategies and methods and get that messaging out there, because we still need to continue to push this out, even though I feel like we say it all the time and that everybody knows. And I think for the most part we do. Again, a lot of that is our own responsibility as neighbors, as parents. If we see others out congregating, or if our own children, we just need to educate them and talk to them about that and how that is not what we're needing to do to slow this spread down right now. Right. Thank you, everyone.
All right, now we have Margaret Reese, Public Information Officer for Mercy, Iowa City.
Good afternoon, everybody. And I'm going to echo what you've already heard from the two previous individuals, which is that prevention is critical, and it is a way that everybody can support this effort to keep this virus from spreading any further and from creating a crisis really in Johnson County and southeast Iowa. So please practice all of the tips that everyone has shared already to prevent the spread. Also, in alignment with the governor's proclamation this week, we are extending the date to potentially resume elective procedures to April 17th, and then we'll continue to monitor that and make further decisions as appropriate. We now have DriveUp Testing at a location in Coralville, a Mercy location, where we can provide rapid influenza and strep testing and testing for COVID-19 through a reference lab, which is a 24-hour or so turnaround for the test results, but they can be done there. The DriveUp Testing supports our telehealth appointments, and it minimizes provider and colleague exposure in the clinic sites as well as other patients, and it conserves PPE, which is critical for us to do by centralizing these tests in one location. So patients will be directed there from all of our Mercy services or affiliated clinics, and providers must call ahead to schedule those appointments. It may be drive up, but it is not drive by. So they must have a medical order before they can go there. Also, our new acute respiratory clinic, which we call the ARC or ARC, is now open in a tent at the same location, but is by appointment only. Providers can refer patients who have respiratory symptoms there for an in-person visit. Patients will be screened when they call their provider. The provider will then determine what the patient needs, whether it is a telemedicine visit to be sent to the ARC tent for a hands-on examination or sent directly to the emergency care unit at the hospital. And patients should be directed to the ARC tent if a provider does not feel they can successfully conduct a telemedicine encounter based on the screening evaluation. Patients will be sent there for respiratory symptoms, fever equal to or greater than 100.4 degrees, with cough and or shortness of breath, sore throat, and the need for a physical exam, and so forth. So again, that provides an opportunity to preserve PPE, and it limits exposure to others. We have been asking for donations of fabric masks. The instructions are on our website, the banner for COVID-19 at the top of our page, and we are receiving those from the community, and we appreciate those so very much. We have received donations of gowns and N95 and surgical face masks, face shields. Johnson County Department of Public Health has been enormously helpful in obtaining those items for us, and we are getting them from other clinics and providers and businesses in the community, and we appreciate that very much. We have made 1,200 face shields in-house. We have volunteer staff members who are making another 500 to 600 this week. We requested liquid soap last week, and we have that coming from Johnson County Emergency Management, from Costco. We've had other garments come from some of the food purveyors in town and so forth, and we are very, very appreciative. PPE is a continuous critical need at Mercy, I'm sure at UIHC, at the hospitals throughout Iowa and across the country. And we're very appreciative to Johnson County Emergency Management for the assistance that they have provided to us. I'm going to close by saying and reminding everyone, you may not have known this, but yesterday was National Doctors Day, and we called that National Providers Day at Mercy. And we want to acknowledge and thank all of our own physicians and providers and all of those locally and across the state and country for the care that they always provide, and especially now. Their courage and their willingness to step up at this time is truly remarkable and heroic. And we also want to thank all of those caregivers, wherever they are, whether they're in a hospital or a care facility, as a hospice provider or home health care provider, wherever they are, who have to go to work every day, and all of those others who have to go to work every day to keep all of us safe by providing food, shelter, daycare, public safety, emergency help, keeping the lights on, the water running, and all of those things that we depend on. We at Mercy appreciate all of you, all of them, very, very much. So are there any questions?
Travis with KWWL. I think, we could maybe, based off of stories we've seen, maybe from other areas about drive-through testing, we could kind of conceptualize what it looks like, but would you be willing to kind of just explain it a little bit right now?
So the DriveUp testing that we have is actually under a large overhang, so it's protected from the elements, which is very, very nice. And a patient who is being directed there will have an appointment to do so. They will have already been screened, and they will be sent there, and then they will be asked when they get there to park at the edge of the parking lot, call that particular office, and then they will be directed to go under that overhang, and a provider wearing the appropriate PPE will come out and do the test. So that's how that works.
Did that open yesterday?
No, that opened last week. We started providing that last week. The new acute respiratory clinic at the same location in a tent in the same facility and parking lot opened yesterday.
I know we've talked a lot about how the guidelines to get a test are, I think, administered by Iowa Department of Public Health, or is it by the National Department of Public Health?
Iowa Department of Public Health has the guidelines that we follow.
So does a medical provider, like someone who works for Mercy, do they have any say in the process? Like, could they at any point maybe divert someone and say well, we're pretty sure you have it, so you're not going to get a test? Or is it pretty stringent, follow the same route every time?
Well, as I mentioned before, there are certain symptoms that they are looking for, and then if they determine that someone should be looked at further, they can refer them then to that DriveUp tent, or not DriveUp tent, to the DriveUp location for testing for strep, for influenza A or B, or for COVID-19. If they feel that it's more acute and they need to be seen, now they're referring them to the ARC, the Acute Respiratory Clinic tent that we have. And if they feel it's really dangerous, then they would refer them to our emergency room, and again, call ahead with their medical order, and they would be seen in the tent that we have constructed outside of our emergency room, which again is a way to optimize the flow to keep patients with those acute respiratory symptoms away from the other patients in the emergency area, as well as the caregivers. But the physician is in charge, but they're following the guidelines of those symptoms. And if they feel that there are some of those symptoms and other reasons or whatever, they are going to refer them for testing.
Has there been any kind of cross-training or anything, for healthcare workers who may work in those elective surgeries that are being postponed, to get them retrained to help in the COVID-19 response? Is that happening?
We have a labor pool. We have always had for decades a plan for labor pool, which gets updated on a regular basis, and we've implemented it at this point. And the labor pool has been up and running now for several weeks. And so staff members, whether they are clinical or non-clinical, who are not fulfilling their normal role, are being redeployed to areas where their skills are most needed. And then they go through extensive training appropriate to PPE and so forth to be able to perform these other functions. So yes, we are using everybody, and they are getting the training that they need to be able to work in different areas.
Thank you.
You're welcome.
Yeah, we have another remote question here from Zach Smith. What different services are being offered by the acute respiratory clinic that weren't being provided by the original testing tent?
So what is being done in the acute respiratory clinic it would be seeing the patients who would ordinarily be going to one of the clinics, that a telehealth visit is not adequate. Telehealth, of course, allows us to keep patients from coming into the clinic and potentially exposing others, the caregivers, as well as other patients who may be there. And it helps us preserve the PPE, or personal protective equipment, because they don't have to suit up every time somebody comes in. So if the provider feels that a telehealth visit is not adequate and somebody needs to see them in person, then the tent allows us to see those patients for the same reasons, that you're not using PPE in the clinic, you're not exposing other people, you're sending them to one specific location where they are able to see and treat or test appropriately.
Hi, Emily Chavez with KGAN. I just want to double check, is the DriveUp testing is only in Coralville? Is that the only one for emergency?
That is the only, one location for the DriveUp testing, one location for the acute respiratory clinic, and then for the really serious cases, they come to the tent outside of our emergency care unit or emergency department at the hospital. Yes.
Great,
thank you.
you.
And again, all of these are allowing us to see patients, to take care of patients. The telehealth has been fabulous. We didn't have telehealth until exactly a week ago, and we saw 150 patients that way yesterday, which is an amazing ramp up, and it's going very, very fast, and it's going to continue like that. But it allows us to preserve that PPE that we desperately need, and we're trying to conserve in every possible way. So if we have these centralized testing places, it means we have one team that is suiting up in that one area, and we don't have multiple teams in multiple areas suiting up. All right, thank you very much.
All right, now we have Patty Fields, Vice President for Impact and Engagement with United Way of Johnson and Washington counties.
So in thinking about all the things we've already learned today, today is really thinking about the volunteer aspect of responding to community needs. So United Way of Johnson and Washington counties has a long relationship in partnership with Johnson County Emergency Management to respond to disasters in the community, dating back to the 2008 floods, with the coordination of those spontaneous, unaffiliated volunteers who are looking to help the community in any way they can, and helping them connect to those volunteer needs that are identified as priorities and where they are already asking for them. Along with that comes the documentation of how those volunteer hours are documented, and then we're able to leverage those for the community match for state and federal reimbursements back. So the volunteers have a very important piece to all of this, even when that is different now than in times before. So as of March 16th, the Emergency Volunteer Center was activated and now has a site that is covid19volunteers.org, and that's where volunteers who are looking for things to do to help the community in the best way possible can go and look for those opportunities, and also for the organizations and all the other needs can come and find and let us know what they need, and it is listed there too. So it's a good matching place. Some of those needs right now certainly around from the DeGowan Blood Center that we do need volunteers to donate blood and plasma. We also have other volunteer needs with Table to Table, some of the food organizations, the food pantries, and we also have coming up tomorrow the Free Community Laundry Day in a partnership with Laundromania at the 5 Laundromania locations in Johnson County, in Iowa City, Coralville, and North Liberty. For those who have already some struggling with financial, who need some support to do their laundry, that volunteers will be there at those sites to help them access free laundry for that day between 8 and 5. Of course, the importance of social distancing is also built into that. So if anyone arrives in a car, they're asked to stay in their car while their laundry is running to keep the number of people down in the building, as well as asking them not to bring their children with them, or to actually take their laundry home to fold instead of folding inside. So of course, all of those things are very important. So there's all kinds of volunteer opportunities there. We encourage volunteers to be active and engaged in whatever ways they can. We also have seen quite a change in our community around volunteerism just in the last 3 weeks. Certainly, as we know, more social distancing is important. Those volunteers who are 60 and over are now not being engaged in that process of volunteers. And with the university changing the way that the students are accessing their education the rest of the spring semester, the University of Iowa students. Those are 2 very large blocks of volunteers that connect into the community. So it has had quite an impact on many of the service organizations who rely on volunteers to serve people, and especially at a time when there's going to be higher need. So we really are that connection. So again, that's covid19volunteers.org, and it certainly is a great way to connect and help the community. Any questions?
Hi, I'm Sarah Watson with the Daily Iowan. I'm wondering if you have any way to quantify like how many volunteers you need now that there aren't students or older folks who are volunteering.
Sure. I'm going to use an organization that we've been working with closely as an example. So Table to Table is a food rescue organization, and they have typically over 400 volunteers who help them throughout the month to do food rescue, going to food vendors and then bringing that food to the organizations that need that to serve their clients. But 80% of their volunteers were either University of Iowa students or 60 and over. So for them, that was a very large, difficult piece to try and maneuver. So it even took them, we've been sending volunteers and we've had a great response from volunteers, but they're all new. And so for an organization that's already lean with staff and relies mostly on volunteers, they had to really regroup and repurpose their routing and how to serve the organizations. So that's just a quick example, but that is seen throughout the service community. Okay, thanks.
All right, now we have Rod Sullivan, chairperson for the Johnson County Board of Supervisors.
Good afternoon. I don't have any kind of statements, so if you folks have questions.
Hi, Emily Chavez with KGAN. I know that you issued a statement to the governor requesting a shelter in place. Can you kind of talk about that as to why you feel we need to have that in place?
Really, it was just the board responding to our constituents primarily. We talked with our public health director about the ramifications, and we felt comfortable requesting it, so we went ahead with it. We just got that out, so I don't know, yesterday, so we haven't had any response yet.
Hi, Sarah Watson with the Daily Iowan. I'm wondering if, I know that the Johnson County Attorney has recommended that, Johnson and the governor has said that counties and localities don't have the power to declare a shelter in place. And I guess I'm wondering if there was any scenario where you might go against that advice or like try and challenge that legally, if that makes sense.
It does make sense. I have not heard any of my colleagues suggest that. A couple people on Facebook have urged us to do so, but I don't think anybody really is interested in going that far. I think we're just trying to make the case and hope that the governor reacts accordingly, and it's her decision.
Travis with KWWL. Can you give an update as to what % of county staff are working from home right now?
I can try. This won't be very exact, but just the other day I did a quick calculation and figured that somewhere around 27-28% of our staff are what are considered to be essential, and so they simply have to work their regular shifts. That includes the sheriff's office, the ambulance department, medical examiner department, a number of the folks now in public health, and emergency management. There's a few other folks included in that as well. So 27 or 28% are automatically working because they're essential. Beyond that, we have a couple of departments like secondary roads and conservation where people really work very independently. So they've just kind of canceled their meetings and then they're going about their business the way they normally would. So they don't have really any contact with anybody else. So again, they're working pretty much as they would work on any regular day. As for the people in offices, I would say we're somewhere in the neighborhood of 2/3 of the people maybe working at home. I don't know that for a fact, but it's probably close to that.
Are you aware of any like county projects to like repair a water main or like a sewer project or something that like have had to be put off, and that there's like potentially a problem there? I'm just hypothesizing, but
we don't do a lot of water sewer stuff. That's more of a city thing. But no, I think as a matter of fact, what I'm hearing is that building inspectors are very busy. Secondary roads projects are pretty much on schedule. They've had pretty good weather, knock on wood, for things lately. So no, that all seems to be continuing on at the regular pace.
Can you talk about some of the precautions that building inspectors are taking during this time?
Yeah, I don't necessarily know the specifics, but for example, we allowed them to take vehicles home with them, which they haven't done in the past. Previously, they would come in, check out a county vehicle, and then go out. Now they're just taking those to their homes. They're going straight to the inspection sites, and they're just trying to observe the social distancing as well as they can.
Would any of these building inspections be non-essential?
Well, most of the states that have done shelter in place have exempted construction. I think some have included it, but some have exempted it. So, in the absence of anything like that, we've just told them to continue to work. We haven't gotten any feedback from anybody that they've felt like they've been put in a awkward position. So that's good. I think that for the most part, the people they're working with have been pretty accommodating.
Thank you.
Thank you.
All right, finally, we will wrap things up with Dave Wilson from Johnson County Emergency Management.
Afternoon, everybody. So I don't have a lot for you today. I just wanted to talk about a story you probably saw over the weekend from Aaron Jordan. We continue to work with our partners to bring in supplies to kind of fill that need. Strategic National Stockpile supplies were brought in Saturday afternoon from the Guard. Shipped out some gloves to both the hospitals, some gowns, and some face masks. As I mentioned Friday on the conference call, we were able to source some additionally locally procured ones as well. Andy Winborn, those folks brought those back in on Saturday morning, actually. So we wound up shipping out 2,000 N95 masks, KN95 masks, 1,000 each hospital Saturday, and 5,000 simple procedure masks to each hospital for a total of 10,000 that was sourced locally on Saturday. So Saturday was not really a day off for us. There really hasn't been a day off in the last 30 days. But to that end, we've got a lot of equipment that's come in. Ventilators, so far we've got 37 total ventilators that were either brought in through Iowa Mutual Aid Compact from another service. Johnson County Ambulance had some that were current on preventive maintenance that we shipped over. Another ambulance service in the area provided some as well that are awaiting preventive maintenance. We have a tech coming in to do that. But, a total of 37 additional vents have been pushed out amongst our hospitals. The logistics thing, as you know, nationally is in the news every day. We've really tried to focus on that and make sure that our first line, front line providers have the tools they need to do the job. And to that end, I think we've been fairly successful. Certainly appreciative of the volunteers and the donations that we get from private business industry, everything from, taking your 3D printers and making face shields to, the breweries and wineries making hand gel and instant sanitizer. That's all incredibly helpful. The businesses that are shuttered right now for one reason or another and might have PPE, keep it coming. That's very helpful. And as Patty mentioned, that relates to the in-kind donation, in-kind match. So community response has been great. Again, we couldn't do it without support from our elected leaders. Our hospitals have been amazing to deal with down here. Just the team in general. I'd take a flood over this any day. I'd kind of be on the recovery side of this by now. So we're going to day 30 for us. We started working that Sunday night, and it's like Groundhog Day in many ways. But that's kind of all I got for you guys today. So aren't any questions that anybody has? And nothing? Come on, Travis.
Travis with KWWL. This is kind of a general question, but I bet you've thought about it. As we have been seeing, it was 20 new cases, 30 new cases, and now we're kind of at the point where we're seeing 70, 80 new cases every day.
Sure.
Has that added a level of urgency to any kind of, possible emergency plans?
The more people that get here's the reality, right? The more people that get tested, the more positives you're going to find. It's the same way with, I go back to the flu thing, and people are going to beat me up about it, but the more you test for a disease, the more you're going to find it. So we expect to have additional positive tests. What we're really gauging that on is how many of those people need hospital beds. So that's what we check every day. Every day we're meeting with the hospitals, seeing how many staff have got COVID-19 are out for 2 weeks because of that, how many people are in the hospital, how many people have been discharged from the hospital. That's our barometer, right? So if we're seeing the case counts go up of people admitted at the hospital, or seeing a rise in people that are deceased from COVID-19. That's our barometer. The fact that people are testing positive for it just means that we're doing more testing. We're finding more of it. We're looking more, right? So that doesn't alarm me as much because, again, I go back to the basis of it. Most people are not going to wind up in the hospital. I mean, most people just don't. It's just a reality of it. Now, it's a percentage. It's math, right? So if you test more and more people, you're going to find more and more positive cases. We know that. What we're concerned about from a public safety perspective is the hospitals being able to take that surge for the ones that do get admitted. And so we're working closely with the nursing homes, the hospitals, and those folks to see what's going on. How many did you admit today? How many did you discharge today? And that's really the barometer that we're worried about more than anything. Does that make sense, Travis?
It does.
Okay.
In those conversations that you have had with the hospitals, do both parties feel like the bed situation is not at a dire place yet?
Yeah, I mean, we're all planners, right? I said that every day. So they're all working and refining their surge plans. University, Mercy, I've seen their drafts, VA. There's a lot of things that are going on in the background to prepare us all as a community in case we would have a rise in admissions or a rise in staff. I think one of our partners got up here and talked about labor pools. So we're monitoring that and we're tracking that. But right now, there doesn't seem to be a problem. You can go to the website on the state and look at that number of how many people are admitted and how many are discharged. What you have to realize is that's a statewide view, right? So I forget what the number is right now, spot and time, but I can tell you the majority of those people are not in Johnson County hospitals. They're spread out across 99 counties.
Thank you.
All right, thanks.
Sarah with the Daily Iowan. Last week we'd asked about playgrounds, and I was wondering, I had walked by College Green Park and the playground there was closed. So I was wondering if there was any countywide closure or if that was just
So Iowa is one of those home rule states. So each municipality has their own jurisdictional authority, and that's best up to the local jurisdiction to do that. I know North Liberty took that action, I believe it was Thursday or Friday of last week, to close theirs. But that's not something we control, and it's up to the jurisdiction to determine what they're going to do with that. I know Rod's worked with Brad Friedoff in the back of the room with conservation. They're looking at what they're doing. Parks aren't really open yet in the rural area, but it's up to each city to determine that. So that'd probably be best directed to the city manager or the city mayor of Iowa City.
Thanks.
Yep. Anything? Nothing. All right. Anybody else? You're too easy on me. I would mention something. So we had a couple calls about not really food deliveries. I'll call them ice cream trucks. So the ice cream trucks are out running around, right? Please try and respect that social distancing. If you're the ice cream folks, I know what happens with my kids. I've got a 10-year-old, a 13-year-old, or 14-year-old now. God, time flies. They were both birthdays in March. So those kids, when the ice cream truck shows up, they do what every kid in the world does, descend, right? So if you're the ice cream man, try and maintain that social distancing, keep things clean. And if you're the parents, really, watch that because, of course, my phone blew up this morning about the ice cream trucks. And so it's something new. It's a game of whack-a-mole every day. So that's today's thing. So just make sure, that we're doing our part, being socially responsible and trying not to spread the germs. So, all right. Thanks. That was too easy, guys.
Thanks, Dave. Thank you again to the members of the media and for our community partners and for those tuning in. Our next planned press conference will be Friday at 1 p.m. and we will notify you with details. But moving forward, our plan will be to have regularly scheduled press conferences on Tuesdays and Fridays at 1 p.m. Thank you.